Walking backwards on a treadmill. Is it actually beneficial or is it social media hype? Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain the proposed benefits of walking backwards on a treadmill and why I think, at least at this stage in the game, it's premature to say that it's any more beneficial than walking forwards. Now, the proposed benefits of walking backwards on a treadmill are that it activates different muscle groups in different muscle patterns, which is undeniable. It's said to increase knee extension or quadriceps strength. It's also proposed to burn more calories per unit time than walking forwards, which people claim can help out with weight loss. It's also proposed to help relieve knee arthritis pain and relieve lower back pain. But when you really dive into the studies that have studied these phenomena, they don't really pan out. Now, first off, it's absolutely undeniable that you activate muscles in different patterns. And so if you're just looking for some variety in your workout, you're absolutely going to get that with backwards walking. You use your knee extensors primarily to push off when you're walking on a treadmill backwards, versus when you're walking forwards, you use more your hip extensors and glutes to push off along with your calves. Now, I would argue that this is actually better for most people with knee pain, because most people with knee pain, they're not weak in their quads. Their quads are actually often over dominant, and it's often the glutes that are weak. So when you're walking backwards on a treadmill and using primarily your quads to push off, you may actually be playing into that problem further. Furthermore, there were studies that studied standard treatment versus adding backwards walking for 3 weeks in people with knee osteoarthritis. But when you looked at what the standard treatment was, it was things like passive modalities and hip strengthening exercises, which both groups got. But the group that did the standard treatment wasn't doing forwards walking. And so you're not comparing apples to apples, because you can't say that adding forwards walking would be any more or less beneficial than backwards walking. Furthermore, that study measured walking backwards over ground, not walking backwards on a treadmill. Now, another benefit of backwards walking is said to be that you expend more calories per unit time, which people say would contribute to weight loss. It is true that when walking backwards at the same speed as walking forwards, that you consume about 40% more oxygen, which means you're burning more energy per unit time. However, that measure was taken backwards walking over ground, which backwards walking on a treadmill is a substantially different activity than walking backwards over ground. And when you're walking backwards over ground, you may not have a wide open stretch where you're not going to bump into something or run out into traffic. So for those reasons, it's not known whether backwards walking is any better than walking forwards for sustained periods of time for losing weight. There was another study that said that people who participated in backwards walking lost more weight than people who followed a standard protocol. But again, when you look at what that standard protocol was, it was just their usual activities over the prior several weeks before starting the study, not adding any forwards walking to that. So there was a difference in overall activity level between the two groups. In other words, it was set up that the backwards walking intervention was going to be found to be effective. There's another study that's often cited that chronic lower back pain can be benefited by backwards walking, but that's more of a biomechanical study. It shows that the lumbar extensor muscles are activated to a greater extent with backwards walking than with forwards walking. And that's proposed to possibly be beneficial for people with lower back pain. But there's no actual clinical controlled trials that show that people who participated in backwards walking were any better than people who participated in forwards walking. Additionally, if you're someone who suffers with spinal stenosis or degenerative disc disease, increased activation of the lumbar extensors may not necessarily be a good thing, because the more you extend or arch your lower back, the more compression there is on your nerve roots. And so it may actually be more beneficial to lean forwards on an inclined treadmill when walking, which opens up the spaces in your lower back. And I've got another video that shows the benefits of walking on an incline treadmill forwards for people with spinal stenosis as well as knee arthritis. And you can check out that video right over there. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.